Nasal vestibulitis, NV, is a common infection. Mild nasal vestibulitis is quite common and treatable. But the severe form is rare. In most cases, nasal vestibulitis is easy to treat and goes away independently. However, if the infection is severe, facial cellulitis, which is a severe bacterial skin infection that requires oral antibiotic treatment, may develop. Some people develop abscesses that need draining by a healthcare provider. In this video, let's together find out more information about this disease. What is nasal vestibulitis? The nasal vestibule is located just inside your nostril or nose opening. Here is its exact position. Nasal vestibulitis disease happens when there is an infection in your nasal vestibule. It's lined with skin that has thick hairs in the nose. The hairs help to stop dust, dirt, and other particles from entering your lungs. Nasal vestibulitis is a common and uncomplicated infection. However, in some rare cases, it can lead to some rare and life-threatening complications. As you know, our nose is part of the danger triangle of the face, because of many of the blood vessels in this area directly linked to the brain. This means that infections here may spread to your brain, although this is very rare. Some possible complications of nasal vestibulitis include the following: facial cellulitis, cavernous sinus thrombosis. What causes nasal vestibulitis? Staphylococcus bacteria is the most common cause of nasal infections. Actually, there are many types of bacteria that live in our noses, but they're usually harmless. Once there's an injury to the tissues inside the nose due to plucking nasal hair, excessive nose blowing, picking your nose piercings, the bacteria can enter the wound and cause infection. Other potential underlying causes of an infection include viral infections by herpes simplex and herpes zoster, allergies and upper respiratory infections, and cancer. Symptoms of nasal vestibulitis. The symptoms of nasal vestibulitis vary based on the underlying cause and severity of the infection. They include fever, dryness, bumps filled with pus, a pimple-like bump inside your nostril or small bumps around the hair follicles inside your nostril, folliculitis, crusting in or around your nostril, pain and tenderness in the nose, sometime it may bleed, boils in your nose. How's it treated? Treating nasal vestibulitis depends on how serious the infection is. Bacitracin topical antibiotic cream is usually the first choice if you have mild symptoms. Apply the cream to your nasal vestibule for at least 14 days, even if your symptoms seem to go away before that, to keep away the antibiotics restriction. If you have boils in your nose, this means your infection becomes more serious. An oral antibiotic and a prescription topical antibiotic such as mupirocin, Bactroban, should be required. Many doctors recommend dicloxacillin in tea case. Apply a hot compress to the area 3 times a day for 15 to 20 minutes at a time to help drain large boils. That's all information about nasal vestibulitis. Thanks for listening. Do not forget to like, share and subscribe for HeInfo channel if you think this video is helpful.